A reworked narcotic, how can survive excess warmth and remain efficient for 1000 days, could revolutionize the capacity to hold new mothers live, the Planet Public Health Organization, WHO, says. The medical, named as warmth-stable carbetocin, helps hinder occasionally deadly hemorrhage following female offer childbirth. It could potentially be taking into account to millions of mothers world. Current drugs can assist, but warm, wet facility in lot countries may halt the rescue medication work. So, on 70,000 female die every year due to harsh hemorrhage following birth. These as called puerperal hemorrhages, as well growth the hazard of their babies moribund in the at first monthly of lifetime. To gear the issue, the WHO now suggests an injectable of oxytocin be proposed to all female giver childbirth vaginally. But it is suggested how the medical is stored among 2 and 8 degrees of the time it is made to the time it is utilized, that WHO experts say is frequently unattainable in countries in slight accessing to cooling and insecure force supplies. In the test, published in the New England Magazine of Medical, nearly 30,000 female in 10 countries through the ball were randomly posted an injectable of warmth-stable carbetocin or oxytocin once following they gave childbirth. Researchers found how in largest cases, both of drugs were alike nice at prevent undue hemorrhage following childbirth. Experts say the paves the way for the warmth-stable carbetocin to be proposed to all female giver childbirth vaginally through as lot as 90 countries about the planet. And they say it could be especially helpful in areas wherever the oxytocin is non-standard or has been tampered in, so down there is less than of the busy component rather than is desired. WHO specialist Dr. Metin Gulmzoglu told The Growth of a Narcotic how remained in work procedure in hot and wet facility was really nice news story for the millions of female who offer childbirth in components of the planet out of accessing to safe cooling. He added, it will assist to rescue lot lives of mothers in reduce revenue countries wherever largest deaths happen. And the WHO CEO General Dr. Tedros Adhanom Ghebreyesus told, "The is a really hopeful new growth how can revolutionize our capacity to hold mothers and babies live." The narcotic is already accessible for some uses, and regulators will now see at if the narcotic can be adopted for broad utilize. WHO experts say they expect it will be accessible in several countries as previous following year. The test is a cooperation among the WHO, MSD for Mothers and Ferring Pharmaceutical.